Hi, welcome to Case of the Day, and today is the 95th case, five away from reaching a century. And today's topic is titled The Dots and Bands of Early Asbestosis. So, this is a 55-year-old who worked in shipbreaking for 20 years but stopped 12 years ago. Minimal dyspnea and came for a scan yesterday, and you can see these reticular opacities, a little bit of subpleural sparing. When you look at something like this, you might say, okay, this is perhaps an NSIP like pattern, but with asbestosis, you just say it's an asbestos ILD, uh, early, mild, and then leave it at that. And most of the times we see advanced disease like this. Patient worked in a brake lining industry. He had calcified pleural plaques. This is a UIP pattern, and it's quite straightforward. To get early disease, at least in our practice, is not common. We don't see these patients for some reason. And then I remembered that when I started doing HRCTs, we had a new scanner called the HiQ that was installed in Bombay Hospital, which allowed us to do 1 millimeter HRCT images. And this paper, I had met Dr. Akira at the AOCR, I think later in 99, 2000. But this was an amazing paper. It blew our mind, that somebody could look at these histopaths and then look at in vitro CT scans and put patterns together. And they talked about subpleural dots and bands. And 30 years later, he is still writing, and he did this paper in Insights into Imaging, where he's looked at a bunch of pneumoconioses, specifically and including asbestosis. So, in early asbestosis, we get these subpleural dot like structures which are due to peribronchial fibrosis, and then lines and bands which are typically coalescent dots, along with intralobular core lines and interlobular septal thickening. And I think what is a little characteristic, probably also a combination of a little bit of subsegmental atelectasis, are these subpleural lines. They are usually less than a centimeter away from the pleura, usually within 5 millimeters, as we see here. And then we see some of these dots here and here. Also, you see intralobular, interstitial, and interlobular septal thickening as part of the fibrotic process. But it's not common to get band like lesions, and so this seems a little distinctive. The other side again shows intralobular septal, lines or core lines as he calls them, and we have interlobular septal thickening extending towards the pleura, a little bit of pleural thickening, and you could imagine that all these are dots. My feeling and understanding is that the dots were probably in those days um, just reticular opacities that we were not able to see because of the resolution at the time. And then based on how they were sectioned, they appeared as dots. So a good thing would be to just use the term reticular opacities and then just look at this concept of having linear subpleural bands that parallel the pleura here, which may be a little distinctive for early asbestosis. Involvement is dose dependent with a latency of 20 years, and so screening for disease should be considered based upon the first year of exposure and then take it from there. This patient has had progression over 9 months. These are 3 millimeter minips, just to show the intralobular core lines, the interlobular septal thickening. So basically, the reticular opacity is very well, and the fact that you get these subpleural band-like structures. Now, in a patient not known to have asbestos exposure, it's not possible to use these signs and say, oh, you know what, this patient may have asbestosis. That doesn't really work, because NSIP patterns in connective tissue disease, etc., can all pretty much look the same. But in a patient known to have asbestos exposure, especially when we're looking at early disease like this, it would be interesting to see this kind of pattern. And for me, it's just from a historical perspective that when Dr. Akira described this 30 years ago, um, times were a little different, the resolutions were different, but he did talk of dots and bands, and we're still seeing bands. I was just very intrigued this morning when I was reading the scan to see all of that. That's the AI talk seminar that we're doing online about a month from now, and my WhatsApp channel. Thank you so much for viewing this.